Drug testing is a critical part of any drug-free workplace program. It scientifically determines if an employee is under the influence of a substance prohibited by your alcohol and other drug policy. It can also prevent substance misuse, as employees might think twice about using if they know they could be tested. It's important. And so is deciding how to respond when someone tests positive. Do you fire the employee or refuse to hire the applicant? Let them try again after the drug is out of their system? Mandate counseling? It's up to you, but it's important to have a plan in writing that meets multiple business objectives. Objectives like maintaining a safe and productive workplace, minimizing risks and liabilities associated with substance misuse, maintaining the health and well-being of the core of your company, your employees, and of course having enough workers to get the job done. Now, assuming you are conducting best practice drug testing, including the use of a medical review officer, a positive test result is pretty straightforward. The person has a prohibited amount of a drug or multiple drugs in their system without a verifiable medical explanation. But the reason your employee tested positive is anything but straightforward. They might have accidentally taken an outdated prescription, made an impulsive decision while socializing with friends, or simply used the drug to get high. They also could be addicted to the substance and have a substance use disorder, a medical condition. In that case, their use was probably more tied to their disease than a desire to get high. You likely won't know whether the drug use was associated with casual use or a substance use disorder. But it's important to understand the human variables to identify a policy approach that benefits your company and your employees. Doing so enables you to think beyond the test result and design a response plan that focuses on the root of the problem, the cause of the test result. How you choose to respond, especially in situations where substance use disorder is involved, can obviously meet your business objectives, but also have a lasting impact on your employees' well-being. In addition to the human issues behind a positive test, you also need to consider your business values and priorities. If you're struggling to find workers, you might be more willing to offer a second chance instead of letting the person go. On the other hand, you might terminate if your employees do highly safety-sensitive work. Then there's the impact on the bottom line. Terminating, rehiring, and retraining an employee is expensive. It can cost between 25% and 200% of the employee's annual compensation, and that doesn't even include the loss in company knowledge or productivity. Finally, before locking down on how you'll handle a positive test, you need to consider any relevant authorities you're subject to, like the Department of Transportation, that stipulate whether a second chance can or must be offered, and if so, how it should happen. Considering all these variables, you might be tempted to take a case-by-case approach to a positive drug test, but this can lead to inconsistencies in policy enforcement and expose you to liability. Instead, your policy should articulate well-thought-out consequences and procedural guidelines. Ultimately, you'll decide to either terminate the employee who tests positive or not. But either way, there are operational considerations you need to think through. If you choose to terminate, will you terminate everyone who tests positive, or only those in certain positions or who have been with you for a certain amount of time? If you're going to treat different people and situations differently, your decisions need to be based on objective criteria, like position or tenure, and consistently applied. Can they reapply later? If so, be sure to address any requirements around a rehire or reinstatement. You might be inviting a repeat performance, for example, if you only require they test negative before reapplying, versus confirming they've addressed and dealt with the problem. Ideally, this confirmation would come in writing from a counselor who's assessed the employee and made appropriate recommendations. And if you're tempted to institute a policy that says you'd never hire someone back after a positive test, talk to your attorney to be sure there aren't ADA violations at play, since the employee could now be in recovery. If you choose to retain the employee, a best practice second chance policy includes referring the employee for a drug and alcohol assessment and then to any needed services. Termination typically happens if the employee refuses to complete the assessment or the counselor's recommendations. Have the employee sign a written agreement detailing your expectations and what happens if they violate the agreement. This can keep your employees on track and provides a structure for managing the referral and return to duty process. Refer the employee to a provider that has demonstrated experience working with employers. They should be high quality, timely, willing to monitor attendance, and willing to provide progress reports and return-to-duty recommendations. Finally, be supportive. Positive treatment outcomes increase when a person feels safe, has support from family, friends, and coworkers, is held accountable for their behavior, and has accessible and accommodating resources to help. Remember, you do need a plan for responding to a positive test, but it's equally important to have a plan to prevent that from happening. So in addition to testing, an effective drug-responsible approach, one that helps prevent and respond to alcohol and other drug problems, includes a written policy and procedures, annual employee education and supervisor training, and a plan to help employees who need it. All these elements work together and send the message that you not only care about maintaining a safe and productive work environment, but that you're committed to retaining a healthy and strong workforce.